Hello and welcome. Today we're diving deep into a complex yet crucial topic: renal vein thrombosis. This condition, often overlooked, can have serious consequences for kidney function and overall health. Join us as we explore its cause, effects, diagnosis, and treatment, arming you with a comprehensive understanding of this silent threat. So, what triggers renal vein thrombosis? The causes are multifaceted. Nephrotic syndrome, a kidney disorder leading to protein loss in the urine, is a major culprit. Other contributing factors include hypercoagulable states, conditions that make the blood more prone to clotting, such as inherited clotting disorders, pregnancy, or the use of oral contraceptives. Cancers, particularly renal cell carcinoma, can also compress or invade the renal vein, leading to thrombosis. Trauma to the abdomen or flank, surgery involving the kidney, and even dehydration can also increase the risk. To understand renal vein thrombosis, we must grasp its pathophysiology. Imagine the renal vein, the kidney's lifeline, becoming blocked by a clot. This obstruction impedes blood flow draining from the kidney. This leads to increased pressure within the kidney, causing swelling and potentially damaging the delicate filtration units, called nephrons. Reduced blood flow deprives the kidney of oxygen and nutrients, potentially leading to kidney damage, dysfunction, and even infarction or death of the kidney tissue if the blockage is severe or prolonged. While renal vein thrombosis isn't extremely common, precise epidemiological data is limited. Its incidence is higher in individuals with underlying risk factors, such as nephrotic syndrome. Studies suggest that a significant percentage of patients with nephrotic syndrome may develop renal vein thrombosis. The occurrence also varies depending on the population and geographic location, influenced by the prevalence of predisposing conditions like hypercoagulable disorders and certain types of cancer. Keep in mind that because it can be asymptomatic, it may be underdiagnosed. The symptoms of renal vein thrombosis can be subtle or dramatic, depending on the extent of the blockage and the speed of its development. Some individuals may experience no symptoms at all, especially if the thrombosis develops gradually. However, common signs include flank pain, which can range from mild discomfort to severe agony. Hematuria or blood in the urine is another frequent symptom. Kidney swelling or enlargement, known as renal enlargement, may also be present. In severe cases, sudden onset of kidney failure can occur, leading to oliguria, or reduced urine out. Diagnosing renal vein thrombosis requires a high degree of clinical suspicion, particularly in patients with risk factors. The initial diagnostic step often involves imaging studies. A renal Doppler ultrasound can assess blood flow in the renal vein and identify any obstructions. Computed tomography angiography, or CTA, and magnetic resonance angiography, or MRA, provide detailed images of the renal vasculature, allowing for accurate detection of clots. A venogram, an X-ray of the renal vein after injecting contrast dye, is considered the gold standard but is more invasive and less commonly used. While renal vein thrombosis doesn't have strict classifications in the traditional sense, it can be categorized based on the extent and chronicity of the thrombosis. It can be acute, meaning it developed suddenly, or chronic, indicating a gradual onset. Furthermore, it can be unilateral, affecting only one kidney, or bilateral, involving both kidneys. The location of the thrombus, whether it's in the main renal vein or its branches, also influences the severity and treatment approach. The primary goals of treatment are to prevent further clot formation, dissolve existing clots, and restore kidney function. Anticoagulation therapy using medications like heparin or warfarin is the cornerstone of treatment. Thrombolytic therapy, involving clot-busting drugs, may be used in severe cases to rapidly dissolve the clot. In some instances, surgical thrombectomy or catheter-directed thrombolysis may be necessary to physically remove or dissolve the clot. Addressing the underlying cause, such as nephrotic syndrome or cancer, is also crucial for long-term management. Preventing renal vein thrombosis primarily involves managing underlying risk factors. For individuals with nephrotic syndrome, controlling protein loss through diet and medication can reduce the risk. Patients with hypercoagulable disorders may require long-term anticoagulation. Maintaining adequate hydration, especially during periods of increased risk like surgery or dehydration, is essential. Avoiding prolonged immobilization and promoting regular physical activity can also help prevent clot formation. Regular monitoring of kidney function is vital for early detection and intervention. The prognosis for renal vein thrombosis varies depending on the severity of the thrombosis, the underlying cause, and the promptness of treatment. Early diagnosis and treatment can significantly improve outcomes and preserve kidney function. However, delayed diagnosis or severe thrombosis can lead to chronic kidney disease or even kidney failure. Recent research focuses on developing more effective anticoagulation strategies and exploring novel therapies to prevent clot formation and promote clot dissolution. Advances in imaging techniques are also improving the accuracy and speed of diagnosis, leading to better patient outcomes.